From pain meds to none, and from feeling like they went from an old man to young again. Hi, I'm Dr. Murray, Natural Integrated Health here in Hastings, Nebraska, doing a video for you here today. And I want you to remind to like and subscribe to our page here. We've got a lot of good, interesting information, case studies, and natural health topics to help you obtain and maintain optimal health. And I'd like to also invite you to our live stream that's going to be coming up on Thursdays at 7 p.m. So like and subscribe. You'll be reminded of those. And during these live sessions, we'll be going through case studies as well as current articles and case studies that have to do with natural health topics. And you're not going to want to miss that. A lot of good information, and also fielding any questions that you might have. So I want to talk about this gentleman who came in, awesome case study. And so this individual came in, he had knee pain for quite a period of time, chronic pain in his knee and shoulders and a variety of different joints. And so he came to our nurse practitioner we had and had PRP therapy, which is a type of regenerative therapy. So it's basically injecting your own serum into your knee, and it helps with healing. It helps it to encourage healing in that area, reducing pain. A lot of neat things about PRP. But in this case here, he had around 80% improvement of his pain. He was happy. He left, he came back a month or so later, but he was still talking about having pain. He's having pain every day, debilitating chronic pain, and this time not in his knee, not in his knee. His knee was doing pretty decent, but he's having pain in his elbows and in his shoulder, in several different joints, and he's tired, he's wore out, he's fatigued, he's got a lot of symptoms. Now, I want to note this, that if you have pain and inflammation, almost always what's going to be coupled with pain and inflammation is fatigue and energy. You're going to be wiped out because that inflammatory process that's going on within the body, that right there is fatiguing. There is an amount of work that's being done in the body focusing on that inflammatory process. Another interesting point to make as well is that you can have bone-on-bone degeneration in your knees or bone-on-bone degeneration in your shoulders and in multiple joints in your body. And the degeneration that's there, the bone-on-bone degeneration, is not truly most often, the cause of the pain. What? What do you mean? You can have patients that have horrible looking knees, bone-on-bone degeneration, they have no pain at all. That's definitely 100% the case. You can ask any orthopedic surgeon that question. I've got patients in my office right now that have completely degenerated ankles. There's like no cartilage there, no cartilage in their knees. Now they have reduced range of motion. They have no pain there, no pain. Pain in these areas is most commonly associated with inflammation. Inflammation is your mechanism of healing that area to try and heal a damaged or injured structure. In this individual, he was taking ibuprofen several times a day and most surely at night, just trying to sleep because of his shoulder pain. So what did we do? We did labs. We tested labs. And so what did we find when we did labs for him? So we found, and we'll have them posted right up here for you, we found that on his first test, he had several inflammatory markers that were elevated. His LDH was elevated, which is an inflammatory marker. He also had his cholesterol levels were elevated. Creatine kinase, another one, was elevated, another inflammatory marker. Also, he had his vitamin D was at a 22.1, significantly low. His DHEA, which is kind of a pro-hormone, was at a 41. It was low. He had other markers of inflammation like his homocysteine levels. They were low as well, into a slightly lower range. So he had signs of inflammation. He also had signs of different deficiencies. His omega-3 levels, the kind of the fish oils, if you may, they were low as well. And so what did we do with him? Well, he didn't have rheumatoid arthritis. He had osteoarthritis. And so we put him on a specific plan. We tested him for food-related sensitivities. We tested his omega-3s. We tested his vitamin D. He also, I think if I recall here, yes, he also had a slight thyroid condition. We can see this TSH is a little clinically high. And he had some lowness in his T4 and those kind of numbers as well, but some slight thyroid dysfunction. So what did we do with him? Change his diet. We had him eliminate for a 2-month period of time. 2 months is not horribly long, but that 2 months helped to save his life, because in 2 months he came back saying that he felt, this is a gentleman who's around 60, I'll just say that, he felt like he was around 90, and now he said he felt like he was 50, like younger than his normal age. He was no longer needing his ibuprofen. He was no longer needing any of that at all, and he wasn't taking any medication. So what did we do? We gave his body what it needed, and we took away what it didn't need. Now, here's some couple little tips you should remember. I always like giving tips on these presentations because you need to take some home things to chew on. Well, first of all, is to try and reduce your excessive amounts of carbs and sugars, your insulin, to reduce that. Almost all of us, probably a good idea to reduce the amounts of carbs. If you're eating a standard American diet, the SAD diet, if you're eating the standard American diet, you need to reduce some of your carbs. Insulin, when your insulin status is higher, insulin drives fat or adipose deposition and also encourages inflammation. Sugar doesn't cause cancer. Sugar doesn't cause inflammation. You use glucose sugars in your body, but it sure doesn't help because it does increase the arachidonic acid cascade. It pushes that inflammatory pathway. So just curtailing your insulin status, especially at night. So if you're eating a lot of carbs and sugars at night, that is not good for your inflammatory status, not good for your body whatsoever. You need to change what's going on metabolically with your body. And by changing what you consume, 1/3 of your body is made of food, 2/3 made of water, you should be able to have an impact on your inflammation by changing what your body is made of. So in this individual here, we had him cut out all gluten. We did this based off a test. His test showed him that he had some sensitivities to gluten. So he eliminated all glutens, and he also eliminated all dairy. He eliminated those two, and he thought I was crazy for telling him to do that, but he did. And 2 months later, he came back and he had substantial improvement. Also, he's taking vitamin D. We also were giving him a little bit of support for his thyroid, his omega-3s were low. Omega-3s, the fish oils. That's kind of the second tip there. If you want to decrease inflammation in your body, yes, curtail and cut out your starches and sugars, in particular in the evening when you're not needing those. You're sitting around, your muscles don't need extra sugar. And so you're eating, and at night, your muscles say, what are you doing? What are you giving to me? So what are you going to do? Your insulin status is just going to be higher. We'll have a whole nother discussion about insulin and carbs. There's another presentation I just did on this matter where an individual had triglycerides up to over 1,200, and they were able to have substantial improvements, reverse their diabetic condition, basically, come from a 10 down to a 6 on their A1C, no medications whatsoever. Reducing your sugars and carbs, especially in those evening hours, are important from an inflammatory status. So that's the first tip. Second tip, if you're not eating fish on a regular basis or taking in the omega-3 somehow through a fish oil, you need to be. That helps to hold in check the arachidonic acid pathway, the inflammatory pathway. Everybody has inflammation. You have inflammation. You're supposed to have inflammation, but you shouldn't have too much inflammation. And if you're eating too many carbs and sugars, and you're just eating a bunch of grains and a bunch of bread and a bunch of bread products, and you're not getting in the omega-3s in your diet, which are essential fatty acids, even the American Heart Association acknowledges that, you need to get them in. Somehow you need to get it in. Either you need to get it in or you need to get it in, right? So you need to eat it or you need to take it, one or the other. But you can test for that. It's easy to test for it. We test for it all the time. Any cardiologist, those are a lot of people would consider those cardiology tests because we know that the omega-3s are good for the heart. And if you've heard that your omega-3s and your fish oils cause AFib, that's true and it's not. It's true and it's not. If it's high, it's not good. And if it's low, it's not good. It needs to be where it should be. So we have another presentation, another recording that we did for you, and you can look at that one as well. to discuss a little bit more on that matter, but you can test and see if it's too low, and then you can take your omega-3s. So on retest with this individual, after he changed his diet, he just eliminated those two things. If you think that's difficult for 2 months, well, how about we just take 40 years of just feeling better, giving you back 40 years of life back on your back to you. Do you think that's maybe worth doing 2 months of something different? Of course. Of course it is. He basically just gave his body what he needed and took away what it didn't. His thyroid numbers improved. We have the numbers right here for you. And he did have a thyroid disorder. As we checked some antibodies, showed that he does have some autoimmunity there. Let's see, what else did we find? His vitamin D, of course, went from, you take vitamin D, it's going to come up. So it went from a 22 to a 41. Let's see what else here. Thyroid improved, of course. The inflammatory markers, the LDH, I was talking about that. Those numbers improved as well. His cholesterol's improved. Cholesterol does mean something, especially if you change your diet and exercise and you see those numbers come down, then obviously cholesterol was being impacted by your crummy diet. So all of his numbers improved. His pain, he didn't need any more ibuprofen. Folks, ibuprofen, good grief. I know that you know this. Many of you know this. But ibuprofen destroys your kidneys and destroys your heart. There's some people in the medical associations out there say that should not be an over-the-counter medication. I've had patients that have basically destroyed their kidney function, their GFR, and as soon as they stop, sometimes their GFR comes back up. Sometimes their kidney function comes back, and sometimes it doesn't. Nobody's deficient in ibuprofen. Nobody's deficient in Tylenol. But this individual here, he changed his diet, changed his lifestyle, he dealt with the nutrient deficiencies we talked about here, he got in the omega-3s, he reduced his insulin status, his blood sugar status, got that healthier, and his numbers improved, his pain improved, he feels miraculously better, so much that he is, according to his own words, preaching it to everybody. And he thought I was crazy for even recommending that he just reduce or eliminate gluten. Do those two things I talked about there today. Reduce and eliminate a lot of your carbs and starches, especially in the evening, right in the evening. You don't need that load of carbs at night before you go to bed. It's just going to go to fat and it's going to increase your inflammatory status 90% of the time. There's a couple other people that's not the case. That's why when you test, you can look and you can find these things and see what your insulin status is and stuff. And secondly, get in your omega-3s. Stop just eating a bunch of bread and corn products and just eating any other grain-fed animal all the time. Start getting in some fish and start doing some fish oil. Get your omega-3s tested. Those are all good things to do. Talk with your physician about these issues. Even a lot of rheumatologists are coming out and they're agreeing that actually eliminating, I've had several patients come from the rheumatologist and they're telling me, yeah, go ahead, cut out gluten. Because they know it's high omega-6, high inflammatory, and it may actually help their condition when they eliminate those omega-6s out of their diet, which a lot of us are just getting in too much through our gluten products. So, got a lot of information we gave for you here today. Do like and subscribe to our page down here. And remember, we're inviting you here to our live streams on 7 p.m. Central Time on Thursdays, and where we are going to give you a whole lot more information, case studies. We got a whole lot more case studies coming to you here, but like and subscribe to our page. I'm glad we're able to talk with you here today, but from hypertension to diabetes and from skin-related disorders to gastrointestinal kind of issues and pain and inflammation, we have a lot of information to provide to you about how to obtain and maintain optimal health. Like and subscribe. Murray Natural Integrated Health, setting the standard in natural healthcare.